that help you fight off viruses and bacteria and fungus and parasites. So zinc, very, very critical for immune function and immune regulation. Another function of zinc that's very, very crucial is healing and repair. Your body needs zinc. Remember, your body's constantly healing and repairing. It's constantly breaking down old tissue so that you can replace it with new tissue. That process of healing and repair is very critical. If you've ever had skin cells slough off, and you have, right? Those are cells that are dead, that are dying, that are sloughing off. Basically, your body is getting rid of those old cells so that you can repair and bring in new cells. Well, that happens in your skin, it happens in your intestines, it happens in your brain, it happens in your liver, your spleen, your kidney, and all of your organs. So remember, healing and repair, very, very crucial. Zinc is important for creating a lot of those proteins that create the structure or the backbone of your collagen, your soft tissue, your muscle tissue, etc. So in the healing and repair process, zinc is one of the most important nutrients we have. It's necessary for the structure of a number of different proteins. So there's an old saying in biochemistry, and that is structure dictates function. Square tires obviously don't roll. So zinc plays a role in folding the different proteins in your body molecularly, the very small microscopic proteins. It helps your body fold them into the right shape so that they work and they do their job properly. Now, another function of zinc is in DNA. It is necessary to replicate and produce new DNA. So we talk about healing and repair. You need new DNA to do that as well. But you need new DNA to make new cells overall. So new cell regeneration, new cell formation requires the replication of DNA, and you need zinc to make DNA. It's necessary for DNA synthesis. The other is the growth and development of tissues. So we're running low on the board here. Growth and development. And this is ever more critical in babies and in really developing babies when their bodies are developing in the womb. Zinc deficiency can cause a lot of problems if a pregnant mother is not getting adequate zinc. The baby can be born with a lower IQ, the baby can be born at low birth weight, there can be a lot of defects that occur as a result of zinc deficiency. So growth and development of a number of different tissues, your skin, your muscles, your joints, all important. Zinc plays a role as well in sperm health. For men, and sperm health, your sperm motility, your sperm speed, your sperm function, your sperm viability depends on zinc. Zinc's very, very important, preserving and protecting the sperm, but also in creating the tail of the sperm, that tail that whips them up so that they can swim adequately, otherwise they don't make it to their target. So sperm health, very, very critical function of zinc. And then zinc also serves as an antioxidant system. So antioxidants. There's actually a system in your body called SOD. That stands for superoxide dismutase. It's a very, very potent enzyme protein that helps to regulate detoxification. It helps to regulate how well your antioxidant systems are working, and zinc is what starts that motor. So those are the main functions of zinc. We'll get into a little bit more here tonight. As well, next topic I want to dive into under this category is zinc absorption. So now that you kind of know a little bit about what zinc does, how do we absorb zinc? Very, very simply put, when we eat zinc, foods that contain zinc, the zinc requires stomach acid. So the food that we eat, and again, most of your foods that contain high levels of zinc are going to come from meats. And I'll talk a little bit more about some more food sources here shortly. But in the stomach, we get the acid helps to break the zinc off of the food, and then once it's broken off the food, most of our zinc is absorbed in the proximal small intestine. So the duodenum, which is a little, and the jejunum, which are again, the sections closest to the stomach. So not the distal part, not the part furthest from the stomach, but the part closest to the stomach. So the vast majority of zinc absorption occurs in the duodenum and jejunum. Now, about 30% of the zinc in your diet, predominantly about 30 to 40% of that is absorbed and the rest goes out. So it's not an all or none. It's not a 100% absorption component. And so, you're not going to absorb 100% of what you eat. So zinc is absorbed in that way. Let's talk about some of the food sources for zinc as well, so that you can kind of see, again, that where you're going to be getting zinc. So let me make a little bit more, well, we'll just change colors. So we're talking about food sources. Number one is meat. It's important that you understand zinc predominantly comes from meat, if you're a vegetarian especially, because it's been shown that vegan diets are actually, I'm going to take that away from number two, and we're going to just draw a little line. If you have a vegan diet, this is actually one of the risk factors for developing a zinc deficiency. Now, that doesn't mean you can't get enough zinc on a vegan diet. It just simply means that if you are on a vegan diet, if you're following a vegetarian-based diet, you want to understand it's very hard to get the zinc from animal-based foods. Some of your animal-based foods that contain zinc, so if we look at, for example, lentils and other beans, we also look at foods like spinach and some of the other greens that contain zinc. These particular food sources, they have high levels of phytates in them, and the phytates themselves are going to stop or basically they're going to compete and prevent your zinc from properly being absorbed. So these, although you can get some from them, if you're going to use lentils, for example, or beans as a source of zinc, you should be soaking them adequately. If you're a vegetarian, soak them and even let them sprout. That's going to unlock your body's ability, your gut's ability to get access to that zinc. But predominantly we're talking about meat. So that, whether that's fish, whether that's beef, whether that's bison, whether that's chicken, whether that's egg, these are the things predominantly that you're going to find the most zinc in. Now, beyond those things, what are some other really solid sources of zinc in the diet? Well, you can get some from nuts, but remember too, some of the nuts have phytates as well, and some people will soak their nuts as well to get better absorption out of them. Pumpkin seed is another really rich source. Bone broth and bone meal, if you've ever used bone meal, but bone broth suffices as well. Pumpkin seed, I mentioned. Avocado is another good source of zinc. Okay, so these are all good sources. Egg is a good source of zinc. Some of your vegetables like beets, okra, parsley, and carrots can be good sources of zinc as well. And I say good sources, not as good as what we see up here. Now, the highest level of zinc from a food, if you like them, if you eat them, is oyster. Oyster, about, pound for pound, oyster is probably your highest zinc-containing food. That's why in some cultures, oysters considered a good food for fertility if you're struggling with fertility issues, because zinc plays a role both in male and in female fertility. So again, these are going to be some of your better food sources. Let's make a little bit more room. So next, I want to talk a little bit about the symptoms of zinc deficiency. So these are big ones you want to know about, because if you suspect that you might have zinc deficiency, these are the things to look for. So if we take a look at some of the different symptoms. One of the most common is loss of smell and loss of taste, really both being a problem. And really, a lot of the receptors in your olfactory, your nose, they help you taste, right? So smell is actually taste when you look at the biochemistry and the science of it. So one of the things that's important to understand is that zinc is responsible for a lot of those neurological receptors of smell and taste. And so zinc deficiency oftentimes will make people not taste food as well. And here's one of the problems. Let's say you have a zinc deficiency and you develop this loss of taste or smell. So what a lot of people do is they gravitate at this point to sugar and salt, because they want to taste their food. And so a lot of the complaints of people with zinc deficiency are, my food's too bland, I can't taste my food. And so what are they doing? They're gravitating towards salty and sweet. And salty and sweet generally means what? It means highly, highly processed. And so highly processed foods contain very, very little zinc, so you're not really solving the problem. And some of the medications actually designed to lower blood pressure. Some of the medications designed to lower pain and inflammation cause zinc deficiency, and that is one of the big problems. Is as you're trying to change your blood pressure with diet, you're taking a medicine that alters your taste, that makes you want to eat more sugar and salt and processed food because you can't taste your food. And then that has the opposite effect of what the drug is trying to accomplish, and you end up just chasing your tail. So got to keep in mind that loss of taste and smell, very, very important. I've had people actually that I've seen come see me that were almost completely loss of taste and smell, like very, very challenging for them. And with zinc deficiency was definitely a problem, and correcting it led to a recapturing or regaining of those senses. So very, very common loss of smell, loss of taste. Those are super common. Now, white spots on the nail bed. White spots on the fingernails. Now, I've got a few videos, if you go back to my archives, where we've talked about fingernail findings, common fingernail findings, and there's some really good pictures of some leukonychia or white spots on the nail beds that are very good to look at if you're trying to imagine what I'm talking about. But if you look at the nail itself, just kind of thumbnails or fingernails, you're going to see like little tiny, almost like white splinters. You can't rub them off. Sometimes when I find them, people come to see me, they say, oh no, that's just trauma. No, it's not. It's actually white ingrained in the nail bed. That's a very, very common symptom outwardly, openly, of a zinc deficiency. So make sure you look at your nail beds. Now, a lot of times where we'll see this happen is after somebody has an alcohol binge. So they drink over the holidays, drink on the weekends, and that zinc deficiency can come on really, really quick because alcohol inhibits zinc absorption. It's actually a very, very common problem in alcoholic zinc deficiency. We can also get hair loss. So if you struggle with hair loss and you're having hair loss issues, and I'm not talking about autoimmune hair loss like alopecia areata, where you're getting this big patchy like hair loss on the scalp, big nummular, round, circular areas of complete hair loss. I'm talking about, hey, the hair is falling out too aggressively in the brush. I'm talking about the hair itself is thinner, it breaks easier. Like, these are symptoms, of zinc deficiency, not necessarily like, again, universal patchy like hair loss, but kind of the weakening of the hair and the thinning of the hair, more prone to zinc. Now, number 4 on this list are immune infections. So a person who is chronically sick, so chronic repeat infections. So if you're the person that picks up every cold, every flu, if you're the person that is constantly wondering whether or not you need to take an antibiotic, like, those are the people who most likely have a zinc deficiency. Again, going back to what I said earlier, if you are buying one of these immune support formulas, like these supplemental formulas, a lot of them contain zinc, and this is the reason why. Poor immune function is a side effect or symptom of zinc deficiency. And so chronic urinary tract infections, chronic respiratory infections, those are big, big problems. Couple of questions that are already coming in. Is taking too much zinc going to disrupt copper? Is there a zinc-copper ratio? And the answer is yes. You can, if you are taking high doses of zinc over long periods of time. So what does that mean, high doses? So if you're taking 100 milligrams of zinc longer than a couple months, you need to start thinking about copper. And so if we're talking about the ratio of zinc to copper, ideally what the research says, if you don't want to cause a copper deficiency long-term with zinc supplementation, that ratio is 7.5 to 1. So about 7.5 to 1. And that's zinc 7.5 to copper 1. Now, some research says that ratio is like 10 to 1. And so, again, if you're falling within that 7.5 to 1 or that 10 to 1, you should be okay and not creating a copper deficiency. But that really is only something you need to worry about if you're getting up over 100 milligrams for chronic periods of time. And you shouldn't have to get up over 100 milligrams of zinc on a daily basis from supplementation over chronic periods of time. And if you are, you need to maybe have some tests done and have some other things looked at. Another symptom of zinc, skin inflammation. And so there are a number of different medical conditions that are linked to zinc, and there are a number of research studies that have linked zinc to creating things like eczema, psoriasis, or psoriatic disease of the skin inflammation. There's a genetic condition that some people, they're born with it, which leads to zinc deficiency. It's a type of skin inflammation as well, but skin inflammation. So if you've got unresolved psoriasis, if you've got unresolved eczema, you might want to look or have your doctor ask your doctor to measure your zinc levels and to have that looked at. Another symptom of zinc deficiency is trouble sleeping. Zinc plays a role in the biochemistry of some of your neurotransmitters, so difficulty sleeping might also be present for many people with zinc deficiency. Fertility problems, I mentioned this one earlier, but you're male or female, you can have, let's just draw us up here. So 6, we said sleep issues. Number 7, we say fertility issues. And again, this is male or female. You don't have to be, a lot of the fertility issues get blamed on women. But what I was saying earlier is zinc plays a role in sperm quality. So if you and your spouse or you and your loved one are trying to have children and you're not able to, and you've been told you have unexplainable infertility issue, then it's very important that both of you get checked for zinc deficiency, because zinc plays a role in egg production and in the health of the egg, but zinc also plays a role in sperm motility and sperm viability. So there are different tests that that doctors can run. So let's say you have low levels of sperm. Let's say you have poor sperm motility and you have low sperm viability. Zinc can cause all three, so it's important that you know that, because it may just be as simple as correcting or supplementing, that's not even a word, supplementing zinc adequately. So again, fertility issues, male or female, can be a sign of zinc deficiency. Another one is irregular cycles or regular periods in women. So when I say irregular, I mean you're not on the 28-day cycle plan. You're on something other than, and that's because of zinc's regulatory capacity to regulate different sex steroids and hormones. And in women, zinc plays a role in progesterone and estrogen. In men, it's necessary for testosterone production. You can't make testosterone without zinc. So a lot of men with low T scores, that testosterone can be a major problem. Another thing that you might see on your lab work when you go get your physical exams or checkups are low blood counts. What does that mean, low blood counts? That means a zinc deficiency can manifest as a low white blood cell count, a low red blood cell count, or a low platelet count. So low blood counts can mean really a variety of any of those things. So if you've had that coming back repetitively on lab after lab after lab, it might be something that you want to do is ask, again, and get with your doc and say, hey, look, maybe this is being caused by zinc. Can we run what my zinc levels are so that, again, we can get that corrected? Now, another very important symptom that's very common, especially today, and we're running low again here, is blood sugar problems. So if you've got blood sugar swings, up and down, hyperglycemia, those blood sugar swings, remember that one of zinc's functions is it regulates insulin. And so, if we look at what insulin is this long protein, and it's made out of different amino acids. But in the very center of insulin, we have zinc holding it all together. Zinc is the center point, or think of it as the table centerpiece at Thanksgiving, right? It is the center point that holds insulin together. And so if you're low in zinc and your body doesn't have adequate zinc, you could be producing an insulin that's less effective, and that can create an insulin sensitivity issue that can lead to blood sugar ups, downs, and swings. So if you're eating right, if you're exercising and your blood sugars are still staying high, zinc deficiency may be part of the reason why. So Those are the biggest symptoms of zinc deficiency. Some of those, let's talk about what can cause a zinc deficiency as well. I think that's an important topic. So now you kind of know what to look for, right? You know how to get it, you know how it's absorbed, you know what to look for, but what are the actual causes? What makes a person deficient in zinc overall? So let's make some room. The most obvious cause of zinc deficiency is going to be poor diet. Now, what does that mean, poor diet? Because poor diet is kind of a social definition. Like we've all been socially conditioned to think that, you know, Gatorade and Gatorade is healthy, like it's a great electrolyte replacement, even though it's not. You know, many of you have been socially conditioned to believe that what isn't true about food is true. And so when I say poor diet, what I'm predominantly talking about is processed food. So if you've got a diet high in processed food, that's a poor diet, right? So if it's got chemicals, if it's got additives, if it's been exaggerated, heated on high, so pasteurized, those types of things, remember those types of things can destroy zinc. So poor diet is a major cause of zinc, or a limited diet. And limited diet is, some people say, well, this isn't a gluten-free diet, isn't that a limited diet? No, I mean, a processed food gluten-free diet is a limited diet, because then you're just eating a bunch of processed gluten-free garbage food. But a limited diet would be like a picky kid. Kids need a lot of zinc because they're growing. Remember, and zinc is necessary for growth. It's necessary for the development of young bodies. So these people, these children are at greater risk than, say, others are. So you want to understand that if your diet is limited, if you're a picky eater, right, I can only eat these 5 foods or these 6 foods, you're going to run a greater risk of a zinc deficiency as well. Now, another big factor is stress. Stress causes all nutrients to lower. Stress causes elevations in cortisol, elevations in insulin, and a hormonal cascade that puts your body in a state of chronic inflammation. And a chronic inflammatory state puts a greater demand on all your nutrients, and zinc being one of those. So if you've got high mental or emotional stress in your life, or if you train too hard, some people overtrain in the gym, they do too much exercise, they're too aggressive with it. Just remember, we have physical stress just as well as we can have mental stress. And then another form of stress is an underlying infection. So if you've got chronic infection underlying, that could be a form of stress as well, as we look at it. Now, in addition to that, diet high in phytates. A diet high in phytates. So this goes back to vegetarian-based diets. If you're on a whole grain / high level of beans, so this is what we call high phytate. So if these are your staple foods, first of all, I'd encourage you to go read No Grain, No Pain. If you haven't already, No Grain, No Pain. We'll talk about why you shouldn't be doing this part of it, but beans are also high in phytates. So if you're using a lot of lentils, again, I mentioned this earlier, you can soak them and you can sprout them, and that's going to make the zinc in them a lot more bioavailable. And you should do that if you're going to be eating these things. However, if your diet is high in phytates as an overall whole, you run a greater risk of developing zinc deficiency. Also, gastrointestinal inflammation, GI damage. And there are a number of different problems that can cause inflammation in your gut, but some diseases, right off the bat that you've probably heard of, you've got celiac disease, first of all, very, very common. This is actually, in my experience, this is the second to third most common deficiency in people with celiac disease who have that small intestinal inflammation. But there are other reasons why we might have small intestinal inflammation. Some people have yeast overgrowth, some people have bacterial infections in their gut. Some people have parasitic inflammation in their GI tract. Some people have developed autoimmune forms of intestinal disease like Crohn's or ulcerative colitis that also cause malabsorption of nutrients. So, these things are very, very common, GI inflammation. Then we have a big one, and I know that this also causes GI inflammation, but I want to talk about yeast a little bit too. Because yeast overgrowth, there's now some research showing that yeast can actually steal your zinc from you. So we can put it up on the screen. I think I've got a study here for you today on how candida, particularly yeast overgrowth, can contribute to a deficiency of zinc because it actually steals and sequesters zinc, from your GI tract. So if you've got a yeast overgrowth or suspicion of a yeast overgrowth, I'd highly encourage you to go back and watch the archives. I did a show several months ago on the symptoms and what to do if you have a yeast overgrowth. So if that's something that you consider might be part of your problem, remember that this can cause a zinc deficiency quite easily. Now, another one on the list is alcohol. I've said this a number of times. I'm going to beat this to death until you hear me. And that's alcohol is not good for you. And I don't care who you're talking to. Most people that think a glass of wine a night is heart healthy, those people are in the dark ages of science. A glass of wine a night is not good for you. Now, I'm not saying you can never have a glass of wine, and I'm not saying you should never have a glass of wine, but I'm saying if you're having 1 to 2 glasses of wine a night and you call that moderate drinking, that's not moderate drinking. That is heavy drinking, and that's going to lead to more pressure on your liver. Remember, your liver stores extra zinc. That's one of the areas that when zinc is absorbed, one of the target areas for it to be stored is your liver. And alcohol is definitely known to create zinc deficiency, especially when taken in excess. And I've got some studies I think we'll put up for you as well if you want to read a little bit more about that, learn a little bit more about the connection between alcohol and zinc deficiency. Another big one, and we talked about calcium last week, but calcium, high doses, mega doses of calcium can cause zinc deficiency as well. So if you are high dosing or mega dosing calcium, you've got to be aware that calcium might suppress your ability to absorb the zinc in your GI tract. And so if you're doing this and you're not having your zinc and calcium and all that measured, you should be, right? Because if you're going to high dose any supplement, really high dose, remember high dose calcium is 1,000 to 1,200 milligrams a day, you want to make sure that you're having your doctor monitor your zinc levels so that you're not creating a problem while you're trying to solve a problem. And even though calcium is relatively harmless for most people, again, if you're on this chronically in high doses, it can really lead to a major problem for you. So, again, if your doc has told you, hey, you have osteoporosis, first of all, go back and watch my show on osteoporosis, because osteoporosis is not a disease of calcium deficiency. But nonetheless, if you're taking, under doctor's orders, if you're taking high doses of calcium, you need to make sure that you're looking at your zinc levels as well. Now, a question just came in: what are the levels of zinc to show on blood work? So, depends on the type of test that's being run. But the levels that you want to have measured are not your serum levels, because that's pretty much a waste of time, is running zinc in the serum, because it can change from day to day based on your last meal. It can change based on stress. So there are a lot of variables in your current day and your current life that can fluctuate your zinc up and down quite a bit. The best way to check zinc is from an intracellular perspective. Looking inside the lymphocyte, what's called lymphocyte proliferation analysis, is hands down one of the ideal ways to measure zinc levels functionally. Remember, zinc is a nutrient that works in the cell, and if you're measuring what's in the serum, you're not necessarily gauging what actually gets into the cell. So my advice is don't rely on serum testing to adequately assess whether or not you have a zinc problem. And then I mentioned earlier there's a genetic disorder, acrodermatitis enteropathica, which is a genetic disorder of zinc malabsorption that can be a major problem, and that's usually associated. Usually that's found in infancy. So if you're watching this and you can coherently understand my words, you probably don't have that condition. Again, this is found more in babies. So if you know of somebody who's got a young infant who's got chronic diarrhea and they're not growing, they're failing to thrive, these are all symptoms that can manifest as a result of that particular genetic disorder. So let's go now to talking about some of the medications that will contribute to zinc detriment. So again, these things can cause the deficiency, but let's also talk about the medicines that cause deficiency, because if you understand this, like many of you, the average person in the United States over 40 is on 5 or more medications. And that's, I've had a lot of people tell me they go to their doctor. If they're not on medications, they go to their GP and their doctor says, what do you mean you're not on any medications? There's something wrong with you. Like, that's a crazy, first of all, that's a crazy thought. But that's kind of where we're at today. But what medicines can cause meds that deplete zinc, right? So one of the big ones rather, are blood pressure meds. So if you're taking medicine to lower your blood pressure, if you're taking diuretics, for example, or ACE inhibitors, or angiotensin receptor blockers, ARBs, ARBs, those 3 classes of medications have been shown in study after study to interfere with zinc absorption and zinc function. So if you're on blood pressure medications, monitor your zinc levels, because when you start inhibiting your zinc, the problem with people on blood pressure medications is, again, you're lowering your blood pressure, try to reduce your risk of heart disease, but then you're lowering your zinc level. And so remember why zinc is important. Remember all those functions of zinc that we talked about earlier. It plays a role in structural proteins, plays a role in healing of the gut, plays a role in detoxification, plays a role as an antioxidant. There's so many different things that are wrong with lowering blood pressure and causing zinc deficiency that actually end up increasing the risk for heart disease. And probably zinc's antioxidant function is one of the biggest kind of tail-chasing examples that I can give you. Now, estrogens, if you're taking estrogen-based medications, know that and it doesn't matter whether it's oral, whether it's sublingual, doesn't matter whether it's under the skin type of approach, doesn't matter how you're using it. Whether it's a lotion, whether it's an under the skin pellet, or whether it's an oral medication. And even those of you who have vaginal inserts that are birth control that secrete slowly estrogens over time, estrogens can inhibit zinc. They can, cause zinc deficiency. Number 3, steroids. And there's an irony with the steroids, because steroids are generally used to block inflammation, right? And so why would we want to block inflammation? Most people want to block inflammation because they're either having pain or they're having some type of chemical reaction on their skin, so some kind of major skin inflammation. Remember what we said earlier? So zinc deficiency can cause dermatitis, inflammation of the skin. So let's take a scenario here. So you got dermatitis, right? Let's change colors. You get dermatitis. The doctor says you have skin inflammation, but doesn't say why you have skin inflammation. So then they pump you full of a steroid, right? And over time, that steroid reduces your zinc. And that zinc deficiency leads to dermatitis. Okay? Who's winning in that scenario? No one, right? Especially if the original reason why you have dermatitis is actually a zinc deficiency and not something else. I mean, there are a number of different reasons dermatitis can happen. I mean, infection is a reason. Some people have vitamin A or zinc deficiency, and that creates dermatitis. Some people are being exposed to things that they're allergic to, so they have some type of topical dermatitis. But bottom line is, if you've got inflammation of the skin, you would want to know why. And if you take a steroid, over time you're blocking that zinc. Remember what else steroids block. Steroids also block calcium, they block magnesium, they block vitamin D. So again, we're trying to block that inflammation, but in doing so, we're creating a zinc deficiency. And remember what's important to heal: zinc. We need zinc to heal. We need zinc to regulate immune function. It's got so many different functions. We don't want to take drugs long term that are going to contribute to its deficiency. A 4th class of medications that can cause zinc deficit are antibiotics. And again, the irony in this one is the antibiotics are designed to kill the infection. Well, zinc adequacy helps your body kill infections through the immune system appropriately. So again, if you're that type of person that has chronic infection repetitively over and over and over again, the type of person I mentioned before, and you go on antibiotics multiple times a year and you're just crushing your zinc and crushing your zinc and crushing your zinc, of course you're going to have recurring infections, because you're suppressing one of the very important, crucial minerals that allows you to fight, that allows you to actually produce the chemicals and upregulate the immune system. Remember, part of zinc's job is to make sure that your white blood cells are adequate and strong enough to do their job. So number 5 on this list, antacid medications. So if you're taking, any of the different acid blocking drugs like Nexium and Protonix or Tagamet or omeprazole, Doesn't matter which one. They all, if you block stomach acid, you're blocking zinc absorption. Zinc requires acid to properly be absorbed. So very, very crucial that you understand that any of these 5 meds taken, and I'm not talking about short-term use, guys. I'm not talking about, you took it for a short period of time, less than a month. I'm talking about the chronic use of these over time is where we start running into the massive deficits and the more major problems associated with it. So again, those are kind of, you look at both sides of this, these are the ways that we can develop a zinc deficiency through choice, through behavior, right? And then these are the ways that we can develop zinc deficiency by trying to treat that choice or that behavior with artificial chemical suppression or artificial chemical manipulation. Remember that no healing occurs as a result of the use of medicines, except for there are a couple of different examples. The biggest example is, I don't want to rag antibiotics too hard because they've saved millions and millions of lives. But if you don't have a bacterial infection, or if the doctor's just prescribing you the antibiotic just in case, like those are bad ideas. You want to, anytime you're going to go use an antibiotic, you either need that, your life needs to be threatened by that infection in a big way, or number 2, you need to have had a culture done where you know what kind of bacteria it is and what antibiotic is best served to kill it. Because many of the antibiotics today, especially drugs like Cipro and some of the other more powerful antibiotics, can create a lot of problems associated with zinc deficiency. Remember, some of the symptoms associated with zinc deficiency are easy wound damage. So you could just injure a tendon, injure a ligament, sprain or strain, it never heals. You could bump into the wall and you bruise super easy and it never ever heals. Well, that's because zinc is necessary for the collagen cross linkages. So the collagen to be elastic and strong in your skin and your blood vessels and your tendons and your ligaments, you need zinc to help bind those cross links on collagen to be strong and elastic. And that's one of the reasons why some of the antibiotics trigger, especially, again, I'm picking on Cipro here, but it's a major class of medication. That particular medication is notorious for creating severe tendinopathies, where the tendons take on tons of inflammatory damage, and then a person can end up crippled for several months after the use of one antibiotic. So my point here to say this is, use it if you need to save your life, but use it judiciously, and don't just jump into it. Okay, let's open the field up for questions. So looks like we got Misty wanting to know, she's chronically deficient in zinc from serum testing. Whenever I take zinc by mouth, I vomit immediately. Why does this happen? That's a great question. I would look at what's in the zinc that you're taking. Zinc, one of the side effects to zinc, I would say, first of all, serum testing, as I said earlier, is not an adequate measure for zinc levels, so don't rely on serum. You get you an intracellular lymphocyte proliferation type of test to see whether or not you're truly low in zinc. The side effects of taking too much zinc for some people, and that's actually a good point. I think we should maybe talk about that to answer the rest of your question. What are the side effects of zinc toxicity? Zinc is relatively non-toxic, meaning it's typically not going to create a lot of toxic symptoms. But one of the primary symptoms of taking zinc, if you're taking too high of a dose, and this doesn't typically happen unless you start getting up over 100 milligrams a day of zinc, but it could just, the minor toxicity of zinc is vomiting, right? And we can get vomiting, we can get diarrhea, we can get severe stomach pains and aches. Like, those are symptoms that you're getting too much zinc. Again, very, very uncommon for something like that to happen. Some people are certainly more sensitive than others, so you have to take your own uniqueness into consideration here. But the biggest side effect of taking too much zinc over time, if we're talking about toxic side effects, is copper deficiency. You take too much zinc and too high of a dose over time, you're going to create copper deficiencies that can lead to neurological symptoms or neurological problems. Remember, copper is important for dopamine and epinephrine and norepinephrine metabolism, so it regulates how you produce certain neurotransmitters, but you also need copper to regulate the myelin sheath. So when you take high levels of zinc for too long, you can actually suppress your copper, and that's what most people are going to manifest over the long haul. But acute zinc toxicity, look, you've got to be getting massive doses, typically well over 200, 300 milligrams a day for that to even start showing up. And most research says 400 milligrams a day or higher is where we're going to really start seeing zinc acute, like immediate toxicity effects. Now that's unless you've been exposed to some type of massive zinc poisoning, and that would happen. For example, a lot of your steels are coated in a zinc, and so like if that's leaching into your food, or if you get accidental contamination of zinc in your food, that's where you might have the acute diarrhea, the acute vomiting. But the other thing, going back to that original question, is you may just be reacting to the ingredients that are in that zinc supplement. There may be other ingredients in that zinc supplement that aren't ideal for you to take. Okay, Kayla wants to know, what about the half moons on your nails? What if you don't have big half moons? Doesn't mean a whole heck of a lot. In Chinese medicine, having half moons is critical. And this is in Chinese medicine. I haven't seen this to hold true clinically across the board. But if you have half moons on the base of your nails, so you've got these little half moons here, if you have half moons on the first 4 fingers, not the pinky, but the first 4, that's a sign of vibrancy and good health. Some are saying that if you don't have half moons all the way across, then you're at risk for development of cancer. Again, I haven't seen that necessarily held true. I've seen full-blown stage 3 and 4 cancer clients with great half moons. So I wouldn't put a whole lot of stock and weight into the half moon. I mean, at least that's my experience. Maybe some other doctors, maybe some other practitioners have a different one, but that's mine. Amber wants to know, how would you go about deciphering the source of your zinc deficiency if you have over half of the causes I've listed? Get with a good functional medicine doctor and have your zinc levels tested. As far as the source of the zinc deficiency, look, it's very easy to look at your diet. Are you eating those foods that I listed in adequate quantities? Or is there some kind of a GI problem? Do you have a history of a GI problem where there's possible malabsorption that's going on? Or is there, one of those other potential causes or triggers for zinc deficiency going on in your life? Like, my advice to you, if don't figure it out on your own, like, don't try to figure it out on your own. Work with a functional medicine doctor to really try to decipher why it's happening so that you can get real answers and get it corrected. Otherwise, you're just going to be struggling. Let's see here. Best time to take zinc and which other minerals interfere with it. So any mineral with the same valence of zinc, so calcium and magnesium and zinc are the 3. They all are basically divalent. So heavy megadoses of any of them potentially could reduce your zinc, but calcium's probably the one that's the most well studied. Best time of the day to take your zinc. There's not a best time, morning, afternoon, night. The best way to take zinc, though, is with food. One of the side effects of taking zinc, and this is even at lower doses, when I say lower doses, what I'm really referring to is supplemental lower doses, not food-based doses, but supplemental. So most of your supplements are going to be anywhere from 10 to 50 milligrams of zinc, depending on the supplement that you're using. So relatively low doses, anything 25 milligrams or less. But when you start getting into that 25 milligram range, if you take that zinc on an empty stomach, it has the potential to create nausea. So when you're taking supplemental zinc, you always want to take it with a meal. The best way to do that is eat about half the meal, then take your zinc, and then eat the rest of your meal. And that way you surround that zinc with food and digestive juices that are going to help break it down and help get it absorbed for you. Let's see. So Cindy wants to know, did I cover recommended daily supplemental dose if you're on a blood pressure medication? There isn't like a recommended dose per se. I mean, the best way to go about it is if you're trying to prevent, if you're on a blood pressure medication, okay, this is my opinion. If you're on a blood pressure medication, the bigger question isn't how much zinc should you take. The bigger question is, why are you on the blood pressure medication and what can you do to wean yourself off of it so that your blood pressure normalizes with your choices and with your behaviors. For most people, high blood pressure is a disease of choice, just like diabetes. It's a disease of lifestyle, disease of choice. We know that from years and years and decades of research. So the bigger question is, not taking your medicine or not taking zinc to offset your medicine, but why are you even on the medicine in the first place? And I don't say that to insult you for taking the medicine. I just want you to ask that bigger question, that deeper question. Because my experience is this: when it comes to drug-induced nutritional deficiencies, you can take the supplement to try to offset the deficiency, but as long as you're taking the medicine, there's always going to be some type of interference factor depending on the mechanism of action of the medicine. So you could try taking 25 to 50 milligrams of zinc a day if you're on a blood pressure medication. Again, the key is to have it monitored. But the bigger question to ask is why is the blood pressure high in the first place, and why are you going to take a bunch of, because remember, blood pressure medications don't just lower zinc. They lower vitamin B1, vitamin B2, vitamin B12, they lower folate, they lower vitamin B6, they lower magnesium, they lower potassium, they lower calcium. So do you want to take all those things for the rest of your life, all in the sake of this one little thing, or do you want to figure out what's going on here, and then you don't necessarily need to take all those different supplements? So I like this question from Monica, because we didn't really talk about it yet. But what are some of the best forms of zinc? There are a lot of different forms of zinc. Let me make some room on the board for you. So supplementally speaking, like what are the best and what are the ones to stay away from? I'm going to give you kind of the short list of some of the better ones. And again, some of the ones to stay away from. So if we're talking about, now this is oral supplementation, Monica, not something like zinc oxide sunscreen, because zinc oxide is a great source of sunscreen, but horrible for absorption, right, if you're taking it orally. So if we're talking about forms of zinc to supplement with, number one, and this is not necessarily in order of best to worst, but zinc citrate is a good form. Zinc picolinate is a good form. Zinc monomethionine is a good form. Sulfate, not as good as the three above. And number 5, oxide. Don't recommend zinc oxide. From an absorption standpoint, it's poor absorbable. You're not going to absorb it very well. It's not going to be super effective if you're really trying to get your zinc up. But citrate, picolinates, and monomethionines are all good forms of zinc in terms of supplements. They're all chelated well. They're all absorbed pretty well, recognized by the GI tract well. So all those are going to be good options for you in terms of supplementing. So Michelle wants to know, can zinc deficiency interfere with diverticulitis? Yes. Remember, what is diverticulitis? It's an inflammation, right? It's an inflammation in the intestines, right, where you get that outpouching and that inflammatory process. So zinc is necessary to heal that. Your gut has a healing or a turnover time of 2 to 7 days. Remember, one of zinc's functions is in DNA synthesis, and so you need to synthesize a lot of DNA for that gut turnover to happen. And if you've got an inflammatory reaction happening in your intestine, it's going to be really, really hard to heal that if you don't have adequate zinc. Antoinette wants to know, best zinc supplement. I think we covered that just now. If you want the best one, like my opinion, is the one I formulated, and that's just because it also has vitamin B6 in it. So when you add zinc and vitamin B6 together, zinc and pyridoxine, understand that a lot of the mechanisms of reaction that zinc has with different proteins and producing different proteins in your body also requires vitamin B6 as a cofactor. So combining the two, there's a synergism when you use zinc with B6 simultaneously. So if you want my opinion on the best, it's my own formulation called Ultra Zinc. You can check that out over at glutenfreesociety.org. Just type in Ultra Zinc and you should be able to pull it up. Chris wants to know, can zinc cause GERD? No, it's not so much going to cause reflux, but again, part of this depends on the state of your GI tract. So let's say that you already have gastric ulcerations and you've got damage in the stomach and small intestine. Understand that your intestine or your stomach has a lining of mucus in it. So kind of look at this. So there's a lining of mucus that kind of wraps around your stomach. Okay, so this lining, it's protective, right? It's a protective coating. And so let's say you already have a pre-existing disease like a gastric reflux, or you have a disease like a gastritis, or you have like an H. pylori infection that's stripped away, or maybe you're taking long-term ibuprofen or aspirin, and so you've ripped away or you've stripped away the mucus lining. And so what's left is the stomach itself, the cells of the stomach, the lining, and those can be irritated by a lot of different things. This is why, some doctors will tell you don't eat spicy foods if you have reflux. It's not because spicy foods cause reflux. It's because generally a person that has an eroded lining of their stomach, when they put something on it that's potentially irritative, if it doesn't have its protective coating, then that can create what appears or what feels like a reflux problem. And zinc is the same thing. If your lining is stripped away, some people don't react well to zinc because they have so much ulcerative damage in their stomach that the zinc, putting it on the stomach, actually irritates it. It's not because you're allergic to the zinc or because you're having reflux over the zinc. It's because your mucus lining is stripped away. This is why I said earlier the best way to take zinc is to eat food, then take some more zinc, then to eat some more food. And that will, for most people, that will basically disengage any of those negative symptoms that you might be experiencing if you're trying to take it on an empty stomach. Let's see here. Wanda, I'm on chemo. How much zinc would you recommend daily? Well, it depends, Wanda. It's a great question. It depends because, you know, how much do you weigh? How tall are you? What else is going on in your life that could be potentially creating or contributing to zinc issues? You know, a standard safe therapeutic kind of amount of zinc is for most people tolerate 50 milligrams a day really, really well. But again, if you're talking about chemo and you're talking about dealing with a chronic, you know, potentially life-threatening disease, really would encourage you to work with a functional medicine doctor to monitor those levels to give you a more precise answer than that. I'm sorry, I can't be more helpful than that. Tina wants to know, is zinc helpful for fibroids? I'm going to assume, Tina, that you mean uterine fibroids. And yes, there's some research that shows that zinc is important for uterine lining health. So it definitely is a possibility that that could be playing a role in it. Whether or not it does, the proof is in the pudding. If you supplement and you see improvement, then you'll know. But again, fibroids have multiple factors involved in producing fibroids, and zinc is just one of them. Let's see, Marie, my friend had a frontal lobe aneurysm and cannot smell or taste anymore. Will zinc help get senses back? Probably not. I mean, you could try, and you know, it wouldn't be a bad idea to have your friend get her levels of zinc tested. But if they damaged the olfactory lobe when they were doing that surgery, probably not going to see those symptoms or the sensations return. Let's see. I think I answered this one already. When is the best time to take zinc? There's not. I mean, morning, noon, dinner. There's not like an ideal time to take it. The time to take it is when you eat, and to take it consistently. So like the key with supplementing is consistency, right? More than it is perfect timing. So like I got to do it at 2 o'clock every day, or I got to do it at noon every day. It doesn't work that way. It's not like if you get it at 12, it's somehow better than if you get it at 4. It has more to do with if you get it consistently day in and day out. Next question, can levothyroxine contribute to the depletion of nutrients as well? Haven't seen any major research studies on levothyroxine contributing to nutritional deficiency. Levothyroxine, for those of you listening, it's T4. It's a form of thyroid medication. And more than anything else, what I've seen with people with levo is their doctors got their dose too high. So if you're on levo and your doc usually will measure or monitor your TSH. And a lot of times what will happen is your TSH will start to drop. And if your TSH is dropping too far below 0.5, then you could be being over-medicated. Like you could be taking too strong of a dose of the medication, in which case that drives up your metabolism, pushes you a little bit too aggressively, can put pressure on your heart, can put pressure on your other intrinsic systems like your thyroid, your adrenal function. And in so doing can tax your nutritional overall stores because you're driving your metabolic systems harder and faster. And when you do that, you're going to need more nutrients to accommodate that. So indirectly it might, but I have never seen a research study, and I haven't personally seen anyone coming through with levo on one of their drug list, and that actually being linked up to any particular deficiency consistently. Barb wants to know, should zinc be supplemented with any other minerals? You mentioned copper, anything else? It's always a good idea when you're doing any kind of higher doses of supplementation to always include a solid multi-vitamin mineral complex. Why? Because generally speaking in nature, nutrients work together. And we certainly, as much as we do know things, we don't know everything, at least not at this point, but it makes good sense that, you know, a lot of nutrients play together, and we know zinc and copper play together, we know zinc and vitamin B6 play together, we know zinc and magnesium play together. So it's a good idea to get just a good multivitamin, multi-mineral formulation, especially if you're doing any other extra high doses of any different nutrients. Leonardo wants to know, does H. pylori deplete zinc? Not so much that it depletes zinc as that zinc helps to produce the mucosal lining that protects you from H. pylori. So think of it more in the other way. It's not so much H. pylori causing zinc deficiency as it is zinc deficiency making you more susceptible to H. pylori drilling a hole through your mucosal lining. Let's see, Linda, is it okay to take a combo of calcium, magnesium, and zinc? Yeah, it's okay to do that. It's okay to do that, although the doses and the quantities are going to matter a little bit. But yeah, it's fine. Let's see. What was the statement I made about inflammation and tendencies leading to paralysis? I don't know that I said anything about paralysis tonight. I said that inflammation in the tendons that were caused by certain types of antibiotics, and that can lead to, you know, severe pain for months and months on end. And that's because, and that's part of the mechanism there, is that certain antibiotics deplete other nutrients, not just zinc, but have a toxic effect on those tendons. Okay, so I think I got most of your questions answered. If I didn't, you know, make sure you tune in next week with that question. And as always, thanks for joining us on Pick Dr. Osborne's Brain. Hey, if you haven't already, hit the subscribe button down at the corner. Once you hit that button, there's going to be a little bell there. Make sure you hit that bell. We've been having problems with emails getting to you on time. I think our information is starting to be suppressed. We're starting to reach more and more people. And I think the powers that be are somewhat suppressing our data and our information trying to get to you. So when you subscribe to the channel, it may increase your ability to get those notifications for us. So make sure you do that. Subscribe, hit that bell, and then as always, come visit me at glutenfreesociety.org. We've got lots of great information there for you on how to navigate the gluten-free diet without killing yourself. This is Dr. Osborne wishing you excellent health. Have a great evening. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.
Stop.